it's made me quite worried about going out, going to the shops and petrol stations or things like that, in case I have to try and communicate with someone and they've got a face mask on. So, I mean, the first hit me the first time I went out. I stayed in for a couple of weeks, and I went out to go to the post office, and then I was about to go out to take a parcel, and suddenly thought, what happens if we've got a face mask on? And they asked me how, you know, they might ask me a question about what type of, you know, stamp you want or whatever. So then I had to go and get my daughter and say, you have to come with me in case they have face mask on. Surely they did have a face mask on. She has to interpret for me. So I've got this feeling of a loss of independence at the moment, you know, and how common is that going to be in everyday life, and how is that going to affect me? And then I'm worried about the fact that they say everyone should think about wearing face masks. And I think, well, if I wear one, it's a bit cheeky for me to wear one and then say to the person I'm trying to talk to, can you take yours off because I can't hear you? So then I'm worried about whether I should be wearing a face mask or not. So that's been something that's been swimming around in my head. The other areas where the COVID-19 has had an impact on me has been in the virtual meetings. Often the connections can be really bad, and it's impossible to lip read from them. So you have to put the automated captions on, and they can be very hit and miss. They can be delayed and they can be inaccurate. And you don't know who's speaking. It's just a list of words at the bottom of the screen. So if one person stops speaking, another person starts speaking, you're not aware of that. So yeah, I mean, I think they're the main issues that I'm dealing with at the moment. I think as a nation, we need to address the issue of face masks and try and introduce clear face masks, or even better, the visors with the bit round here, so that people can see the whole of someone's face. I think, you know, it's important for the medical school to address this, and we've already, you know, highlighted the need for clear face masks and visors to be sourced and supplied. And we do know that this is a priority, something we're looking into. Now that lectures are being recorded, lecturers need to be really thinking about what their captions will be like when they speak. They need to speak clearly, not too fast, so that the quality of the captions can be maximised. It's really important that they put all the important information written on the slides. Don't speak important piece of information, get it there written on the slide. And in virtual meetings, always remember that automated captions are delayed, and often there's going to be a delay from us answering, you know, the question that you might be asking, you know, in that meeting. Just be patient and give us a chance to read the captions, translate what we think you've asked before we answer. My advice is hang on in there. I mean, COVID-19, it's changed the way we live, and there needs to be re-evaluations, the processes in place to help people with disabilities. You know, and I want to say that we recognise that at the Brighton Sussex Medical School. Get in touch with and let us know the main issues are for you. We all have different disabilities. I can't speak for everyone within hearing impairment, and all I can been able to talk to you today about what's worrying me and what my issues are. You know, different people will have different issues. If you're worried or affected by any of the things I've talked about today, just get in touch with me, get in touch with student support, and just don't struggle on your own.